Women and children are a very big part of this story, and with that in mind, I'd like to get the global women's perspectives on this. Please welcome to the stage Her Excellency, Madam Sika Kaboré, and who is the First Lady of Burkina Faso and the immediate past President of the Organization of African First Ladies for Development. Thank you. I'm getting some water for my cough. Her Excellency Yuthar Rawahy, who is, please do come to the stage, founder and Honorary Life President of the Oman Cancer Association as well, and Her Royal Highness Princess Dina Mired, who of course is President of the Union for International Cancer Control. Please welcome them to the stage. Welcome to you. Hi. So my understanding is, Princess, that you have an address that you would like to give us, a statement that you would like to give us first.
Excellencies, ministers and honorable guests, on the occasion of the 2019 World Cancer Leaders Summit, we, a group of women leaders active in global health, call on all cancer leaders and heads of state to take national action. Women, children, and adolescents bear the greatest brunt of ill health and preventable death, including cancer. Meeting their needs by prioritizing prevention, early detection, early diagnosis, and timely treatment of priority cancers is essential for achieving universal health coverage. We call on all heads of state to take national action aligned with the global 2025 non-communicable diseases targets and the 2030 Sustainable Development Goals. We want all women, children, and adolescents to have the rightful opportunity to access life-saving treatment with financial protection that minimizes the catastrophic expenditure, which plunges so many families into or further into poverty. Action on these priority cancers now will save lives now and contribute to the Sustainable Development Goals and the Health Goal 3 of reducing mortality due to cancer and other non-communicable diseases by 30%. The WHO Global Action Plan on Cancer and other non-communicable diseases outlines priority actions to prevent and control cancer based on proven efficacy and cost effectiveness. Action on breast, cervical, and the most common cancer in children are included, as these cancers can be detected early and treated, potentially to cure. The tragedy is that these WHO-recommended solutions are not available and affordable to those in greatest need, women and children living in low and middle-income countries. The divide between rich and poor, between countries and within countries, is driving unacceptable inequalities. We call on all countries to strive to reach the goal of 60% survival rate for children with cancer by 2030, laid out in the WHO Global Initiative for Childhood Cancer. We call on countries to start with the Global Breast Cancer Awareness Month in October to build community awareness, reduce stigma, and ensure that advanced disease has a share of voice. We call on all countries to step up and stop cervical cancer, acting decisively for a national response to the 90-70-90 elimination targets in the emerging WHO global strategy towards elimination of cervical cancer, and put us on the pathway to closing this divide. Translating these global initiatives to national action will bring momentum to integration of cancer services with those for child, sexual, and reproductive health and HIV, build cancer literacy in communities, reducing stigma and changing attitudes, which are often a barrier to individuals seeking help for symptoms that could be cancer, and strengthen health systems by equipping countries with knowledgeable community health workers and robust referral pathways. These steps ensure precious time is not lost connecting women and children with cancer with a confirmatory diagnosis and timely treatment that can give them the opportunity to beat these cancers and reduce unnecessary and unspoken suffering and pain that dying from cancer mean in too many countries. In September 2019, the UN high-level meeting, Universal Health Coverage, Moving Together to Build a Healthier World, brought together heads of state, political and health leaders, policymakers, and universal health coverage champions to advocate for health for all and leaving no one behind. We urge that all stakeholders take action with impact so that at the follow-up high-level meeting on UHC scheduled for 2023, we'll have real and impactful progress to report in all our countries. We open this dialogue today to share some examples of how our work on women, children, and adolescents with cancer is contributing to this call of action. Thank you.
Thank you very much indeed. I'd like now to ask the First Lady of Burkina Faso her perspective on the road mapping that's going on within your continent, within Africa.
Oui, je vais parler en français. Mais avant tout propos, avec votre permission, je voudrais remercier le gouvernement du Kazakhstan pour l'accueil chaleureux qui m'a été réservé à moi-même ainsi qu'à la délégation qui m'accompagne, et également pour toutes les facilités qui rendent mon séjour le plus agréable possible. Je voudrais également remercier ma sœur, la princesse Dina Mired, et Madame Delaïra de Casior pour leur invitation à venir prendre part au World Cancer Leaders Summit dans cette belle ville de Nour Sultan. Alors, de nos jours, mesdames et messieurs, le cancer est devenu un grave problème de santé publique qui concerne tout le monde, en raison des souffrances occasionnées lors de son développement. Nul n'est à l'abri parce que le cancer n'épargne personne. Il s'agit de la deuxième cause de mortalité dans le monde, selon les données de l'Organisation mondiale de la santé. Malheureusement, 70% des décès dus au cancer surviennent dans les pays à faible revenu ou à revenu intermédiaire, comme mon pays, le Burkina Faso. Dans mon pays, en effet, depuis 2012, ce sont environ 7800 nouveaux cas de cancer qui sont diagnostiqués annuellement. Plus de 6200 familles sont endeuillées chaque année, soit près de 25 décès par jour. Le temps que je finisse mon intervention, qu'on finisse cette journée, plus de 24 personnes seront décédées dans mon pays. Mesdames et messieurs, il s'agit là de statistiques alarmantes qui sont certainement en deçà de la réalité parce que de nombreux décès surviennent en dehors des formations sanitaires sans être comptabilisés. Ces données nous privent de tout sommeil, de toute quiétude et sont sensiblement les mêmes dans chacun des pays au sud du Sahara. Mon pays, le Burkina Faso, est résolument engagé afin d'arrêter l'expansion du nombre de personnes et de familles frappées par ce désastre qui porte un sérieux préjudice au développement durable de la nation en mobilisant les populations dans un combat contre toutes les causes qui favorisent le phénomène des cancers. Parmi ces causes, nous pouvons relever les conditions de vie difficiles, l'analphabétisme, la croissance démographique qui n'est pas suffisamment contrôlée, la dégradation de l'environnement, le diagnostic tardif, le très faible accès aux moyens adéquats de prise en charge, à savoir le traitement des lésions précancéreuses, la chirurgie, la radiothérapie, la chimiothérapie et de manière générale le très faible accès aux services de santé. Il s'agit là des facteurs contributifs à la survenue et au développement des cancers. Et à titre illustratif, je voudrais indiquer que 70% des cas de cancer sont détectés à un stade très tardif dans mon pays, ce qui rend leur prise en charge quasiment désespérée. Grâce à un plaidoyer de très haut niveau, ma fondation, la fondation Kimi, a obtenu de l'État burkinabé la gratuité pour les consultations, la mise en œuvre d'un projet BLFI Bimobile qui utilise la téléphonie mobile pour sensibiliser les populations à la lutte contre le cancer, l'acquisition très prochaine de 15 unités mobiles à raison d'une unité mobile par région. Mon pays dispose de 13 régions sanitaires. Ces unités mobiles vont permettre de développer l'offre intégrée en stratégie avancée, prenant en compte le dépistage et la prise en charge des lésions précancéreuses, la planification familiale et la nutrition. En projet également, il y a la construction d'un centre de radiothérapie dont les travaux ont déjà démarré dans l'enceinte du centre hospitalier universitaire de Bogodogo à Ouagadougou. Le gouvernement de mon pays, le Burkina Faso, a consacré 13% de son budget de cette année au secteur de la santé. Cela demeure malgré tout insuffisant au regard des réformes que le ministère de la Santé est en train de mettre en œuvre, en mettant principalement l'accent sur l'intégration des services de soins destinés aux femmes et aux enfants. Aujourd'hui, plus qu'hier, le gouvernement du Burkina Faso met toujours au centre de ses préoccupations l'amélioration de l'offre de services de santé de qualité. Mon pays a en effet pour ambition d'atteindre rapidement la couverture sanitaire universelle. Pour cela, il a besoin de partenaires pour l'accompagner techniquement et financièrement. L'ensemble des acteurs participant à cette rencontre de nos sultanes constituent, à mon avis, des partenaires potentiels à même d'accompagner mon pays, le Burkina Faso, dans ses efforts. C'est pourquoi je voudrais saisir l'opportunité de ma présence à cette prestigieuse rencontre pour vous inviter tous à la conférence que le Burkina Faso organise les 13, 14 et 15 décembre 2019 à Ouagadougou. Cette conférence portera sur la mobilisation des ressources au profit de la couverture sanitaire universelle. Mon invitation sera formalisée dans les prochaines semaines avec l'espoir de vous accueillir à cette conférence au cours de laquelle j'ai l'intention d'organiser un side event consacré au financement de la lutte contre les cancers. J'espère donc ainsi vous revoir très bientôt et vous remercie pour votre aimable attention.
Thank you very much indeed. Well, obviously, reaching out to children, reaching out to refugees has added complications. I'd like to now invite Her Excellency Yuthar Rawahy to talk a little bit about some of those challenges.
Thank you, Sito. First of all, I would like to thank Princess Dina for inviting us and for putting us on the table to discuss this issue. I would like to thank the host country for inviting. I would like to thank the host country for inviting us. We've been having a wonderful time. Thank you for your hospitality. As a 4-time cancer survivor, I know exactly what it is like to be diagnosed with cancer and to receive the cancer diagnosis. And during my treatment, I promised myself that I will do everything possible for my country, for women, children, men. No one has to face this disease alone again. So what we decided is to set up the Oman Cancer Association, which was registered in 2004. We work very closely with the Ministry of Health, the Oncology Center in Muscat. We decided to set up, to build a mobile mammography unit to give access to all women who live in the interior of Oman so that they can have free screening. So far, we've already screened about over 23,000 women. And if it wasn't for this screening, we used to have 80% stage 3 and stage 4 cancers. Now, as I speak, we are 85% of stage 1 cancers.
Yeah.
We set up a home away from home for children because we found it was very difficult for children living in the interior of Oman to access care, where we house over 16 patients with 16 children with their families to have access we have, as it is, we have a sultan who is public-centric. We are very lucky that we are having cancer treatment for free. But unfortunately, there are families who live outside the capital area and they cannot afford to bring their children to the capital to have treatment. So we have set up Dar al-Hanan, a home away from home, to house families with children, and all families. We're having now children from Yemen who have nowhere to go, and we're housing them so that they can afford treatment in Oman for free. All this, of course, was started from my living room, from a simple gathering of cancer survivors and like-minded people. We are now, in 2020, going to host the UICC conference, so we're inviting all of you. We hope to see all of you attend. It is difficult to face cancer, but as everybody has been echoing today, there is a will, a political will, and we have to make it possible as patients, as leaders, to relieve the burden of cancers and overcome the challenges of our government need urgently to actively implement the legislation for universal health for all, and especially the National Cancer Prevention Plan focus for women, children, and adolescents. Empowerment, social mobilization, human resource development, and research matched with realistic budget is the way to go.
Thank you very much indeed. Just like to get a final perspective from you, Your Royal Highness, on we have some journalists in the room, I think, and you know they need to pick up some key messages. I know as a journalist that for me certainly you've got to make it simple. So what are the key messages that you're picking up and what you would like to communicate?
Well, I think I would like to, in a way, the key messages are that universal health care is really the path to giving access to people, equitable access to all people for care. It really is, I look at it as, in a way, the managerial infrastructure that all the tools that we have, whether the best buys, the savings that we can do, how many doses for cervical cancer and so on, it needs a managerial infrastructure to link it all together with the financing. And it is the way to go. And what are the key messages here as well is we have a disparity, and it's an unacceptable disparity, that 70% or more even of children and women, the most vulnerable, and adolescents, the most vulnerable usually in populations, are dying unnecessarily because governments have not really decided to, step up and organize themselves. I always talk about organizing. You can have the best will in the world, but if you don't have a national cancer control plan, if you don't organize yourself as to what you want to do in year 1, year 2, year 3, you're still going to be sitting here and saying, we don't have so many oncologists, we don't have this and we don't have that. Whereas if you had started to put a plan, you could have ticked some of those boxes. It's doable. We've seen people who have done it. From small wins to big wins, it is doable, and the financing is there. Half the time you can find it from just reducing inefficiencies, taking up new evidence, as the former panel said. There's so much that can be done. Prevention, tobacco, fighting tobacco alone. Imagine, how many cancers, third of all cancers you can reduce. There's so many things, and it's not all about money. Money is important, but organization, systemization, and this is what UHC is all about. Thank you.
Thank you very much indeed, and thank you to our distinguished panelists. A lot of very inspiring work going on. Thank you very much indeed.